Carol Huey. I'm the program manager for food, nutrition, and population health. So I'm excited to see all of you here. I will tell you a little bit about our program. Our program focuses on training in food and nutrition practice, policy, and research. We address historical and current inequities in nutrition and food systems and emphasize systems level change. So there's a big emphasis on food systems, a little bit on food sovereignty, and how we can incorporate all the global ecosystem and use that to affect the health of the population. The curriculum includes coursework in behavioral, biobehavioral, and social sciences. There's epidemiology and survey research methods, and there's an emphasis on program planning and evaluation. So here's our faculty. We have Barbara Laraya, who's the chair of the program, and she's a registered dietitian. She specializes in food insecurity, especially in pregnant women and effects on pregnancy and birth outcomes. Leah Fernald is a PhD and MBA who focuses on changing the trajectory of children living in poverty through strategic systemic interventions. She uses economic resources to affect change. Chris Madsen is also the faculty director of the Berkeley Food Institute, which a lot of our students and our faculty are very involved in. We partner with them a lot. She's actually a pediatrician and research scientist, and she focuses on pediatric obesity and physical activity. Isabel Mazzarera is relatively new to our faculty, and she specializes in global nutrition, specifically global food systems, and the determinants of poor maternal and child nutrition outcomes in low and middle income countries. She does a lot of work in Africa. Hannah Thompson really focuses on youth physical activity, especially in schools, and she's an alum of our program. And Sarah Zuba, who's the faculty lead of the online MPH nutrition concentration. She also has a focus in maternal and child nutrition, and she really focuses on micronutrient nutrition. And on the staff side, you have me. I'm also a registered dietitian, and I have experience working in acute patients with cancer and cardiovascular disease. And we have Elsa Esparza, who's an MPH RD, who's also an alum of our program. She's the field supervisor and dietetic internship director. Most of our students go through our 2-year program. We have a 2-year, 4+1, and 11-month program, but the majority of our students are in the 2-year program. As part of the 2-year program, you have 5 school-wide required classes, and you also have our FNPH required courses. There's a core course in public health nutrition, which is, called critical issues. We have everybody take nutritional epi, and then there's a few things that you can choose from for a human nutrition course and a policy course. That kind of creates your whole curriculum, and then everybody takes one integrative learning experience class, which is your capstone. I'm not going to really go through the 4+1 and the 11-month programs, but they're pretty similar. They're just much more structured and more requirements, and there's less flexibility in terms of electives. But the 2-year program has really great flexibility in terms of electives. Now, for that integrative learning experience that I just mentioned, we have a list of courses that are designed to demonstrate synthesis of all the foundational and concentration competencies. And it's just an additional class you have to take and a presentation. So we have a list of 5 preferred or highly recommended ILE classes, and we have a list of some other approved courses, but they're just not as preferred because our faculty are not the ones teaching it. So obviously it's a lot easier when you have our own concentration faculty who you're working with to do your ILE. Elsa Esparza, like I said, is the director of the dietetic internship, and she can answer all questions about this if you have any, but a brief overview of the dietetic internship for anybody who's interested. It's relatively new. We're just piloting it this year. We are accredited by the Academy of Nutrition and Dietetics, and it's considered a standalone internship, but it's in combination with our MPH. So to be eligible for the DI, you have to apply to our FNPH MPH program, the 2-year track. You have to have a DPD certificate already through your bachelor's degree. And you obviously, like I said, complete the SOFAS and the UC Berkeley graduate application by December 2nd for the FNPH MPH program. The other thing you have to do by December 2nd is the DICAS application, which is all laid out. It'll be all in that SOFAS application, so you'll see links for that. And we will be accepting 10 interns each year. So the cohort for the DI will be 10, and we will have other students in the MPH program who are not doing the DI, but they're just doing the MPH. So we'll have a good mix of students. In total, I think we'll have about a class of about 20 to 22 students. Now the structure for the DI includes the 2-year MPH plus 1,000 hours of supervised practice. In year 1, you'll do the MPH coursework, and then in the summer, you'll do a DI course and supervised practice. And then in year 2, you'll continue the MPH academic coursework. And then in the second summer, you'll do another DI course and more supervised practice. So it's 2 years plus including, the one summer in between and the one summer after. So that summer after is the thing that's extra beyond what the normal 2-year program is. The rotations are all very similar to all other DI programs. For this particular internship, there's a stronger emphasis on community and public health nutrition and a little bit less of a focus on clinical. So we do all of our clinical hours in outpatient settings. It's not designed for students who really want to work in an acute care hospital. It's more for students who want to become MPH RDs and work on a more population health level. So we have clinical in the outpatient setting, we have food service, public health nutrition, research and evaluation, public policy and advocacy, and food systems. Like I said, Elsa's contact information is here, so you can contact her if you have more questions about it or if you want to learn more. She's happy to meet with you. The MPH practicum is a part of all the 2-year curriculum students. This is completed in the summer between year 1 and year 2. And like I was just saying with the DI, you also have that supervised practice, but that's one in the same. So we will count the same practicum hours towards that DI supervised practice. So the only difference is that you'll have less flexibility in terms of choosing your practicum as the other 2-year students. So the school-wide requirement of 400 hours, those same 400 hours would count towards the DI for those students. It's 12 weeks full-time completed during the summer. The RISE office provides the structure and all the administrative needs for this component, and there is some funding available. And like I said, the dietetic interns will complete extra paperwork to make it count towards your internship. So Elsa also runs the practicum, so she would answer any questions. And you can see on the slide that we have some examples of where students have gone. This was from 2022. In terms of admissions data and averages, we have an average acceptance rate of 69%. Most of our students are around 25 years of age, so they've had a couple of years out of undergrad. The average GPA is 3.6, and we have an average cohort size of 16. I'm sorry. Like I said, with the DI, we're hoping to accept 10 students, so I think that average cohort size is going to start to grow closer to 20 students starting this past year. So this year we have a total of 26 students. That includes the continuing students. Next year, because our cohort of the first years is so big, we will likely have closer to 30 to 32 students. We pride ourselves on being kind of a smaller program and having a lot of community support. We know all of our students by name and what you're interested in. We kind of keep track of everything. We're very hands-on in terms of advising. Our faculty advisors are assigned to each student. Students are encouraged to meet with any of our faculty advisors in FNPH or throughout the School of Public Health. And you can discuss your program of study, any academic progress, your career goals. They have great ideas. We also set up student buddies for all of our students in FNPH. So the first year is the summer before you come, you'll get assigned a second year or continuing student to kind of talk you through any of those peer-to-peer logistical questions that you might have about living in Berkeley or the program, choosing classes, finding jobs, that sort of thing. And me as the program manager, I offer advising appointments. I have a link that's open to anybody. It's open to all of you. Any prospective student or any current student, also alumni will reach out to me to talk about career advice. I go through everybody's transcripts manually one by one to make sure everybody stays on track every single semester. So there's a lot of support there. I reach out to students to make sure you're taking all the classes you need, and students often come to me to ask questions about like, what should I take? When, how do I create my curriculum so that I can get to whatever career goal you have afterwards. So I am here for all of those students. We also, like Lori said, there's a dream office. This slide is old, but the Center for Public Health Practice is now called RISE. And there's the MPH librarian, all to help support students. And here's our email address if you have any questions.